Native American COVID-19 perceptions and testing hesitation. According to reports from the Brookings Institute, American Indians and Alaska Natives are 3.5 times more likely to contract COVID-19 and 5.7 times more likely to be hospitalized. These communities also have the highest COVID-19 mortality rate in the U.S. Reasons include high rates of poverty. North Carolina boasts the highest American Indian population east of the Mississippi River, with 8 recognized tribal nations representing 1.2% of the population, according to the 2020 census. More than half of tribal members live in Tier 1 underserved communities. The BRAVE project collaborated with the University of North Carolina at Pembroke and the Lumbee tribe, whose tribal territory expands the counties of Cumberland, Scotland, Hoke, and Robertson, with the largest population of American Indians in the state. The University of North Carolina at Pembroke, a historically Native American school, is the first in North Carolina. The primary goal of our study is to better understand the perceptions of COVID-19, as well as any barriers to testing and vaccination that could explain the disproportionate impact of the disease on American Indian communities in these 4 rural counties. From February 2021 to April 2021, we conducted virtual, semi-structured interviews via WebEx. Eligible participants were 18 and older and self-identified as American Indians living in Lumbee tribal territory. Participants were recruited using flyers disseminated through the tribe's Facebook page and website, as well as those of the University of North Carolina at Pembroke and the American Indian Women of Proud Nations, as well as other partners. Participants' ages ranged from 20 to 72. Most were female, college graduates working full-time. Nearly all participants knew about COVID-19, but 8% did not believe in it or were uncertain about it. Regarding protection, 92% viewed the mask mandate as a good thing, while 35% did not like wearing masks. 23% felt the masks were a minor inconvenience. In Figure A, 85% of individuals received information about the disease from media outlets including online news, but only 35% reported getting their information directly from the CDC. Just as many people reported getting COVID-19 information from their healthcare provider as they did from social media. In Figure B, it was clear that trust in COVID-19 information depended on the source. 35% of respondents stated that they found COVID-19 information confusing. 19% of respondents had little to no trust in the government. 31% preferred to do their own research, and only 19% stated that they trusted their source of information. In Figure C, the tribal office and outreach by the health department were considered the best ways to communicate information about COVID-19 to residents. This was followed by communication through the church, social media, and tribal newsletters, mail, and the website. Communication through family members was mentioned more often than through healthcare professionals. Flyers, town halls, and giving rewards were considered the least popular methods of communication. In Figure E, even though healthcare providers were not considered the most efficient ways to communicate information about COVID-19, when we asked respondents about support, information from doctors about COVID-19 and social support were the most common responses. This was followed closely by food needs, especially for elders who were unable to resume daily activities due to COVID, and mental health needs. Some respondents mentioned needing help financially and with their physical health conditions. Less common responses included help with online education, help for seniors, help for members living outside of tribal areas, and sanitizing resources such as masks, hand sanitizer, etc. In Figure E, it was evident that other people's opinions of testing influenced our respondents' perceptions of testing. This also included political affiliation. Additionally, some refused testing because they did not want to have to pay for it, worried about accuracy, or did not want to have to share their results. 15% stated they had difficulty finding testing. In Figure E, most respondents had a negative perception of the COVID-19 vaccine. Only 8% stated that they felt good about it. The most common concern was safety, followed by the need for more information. 35% of respondents had heard reports from others about negative side effects and were still skeptical. It is noteworthy that 42% of respondents were vaccinated, and an additional 19 were planning to get vaccinated. So this means that the concerns do not go away once a person is vaccinated necessarily. In conclusion, we're finding that there is still a gap in communication at the community level regarding COVID-19 education and access to reliable, trustworthy information. Significant investments in culturally appropriate educational interventions are still essential to improve the perceptions of COVID-19 testing and vaccination, as well as to mitigate vaccine hesitancy in the American Indian community.